Hi everyone, and welcome to the second presentation. In this presentation, we're going to talk about equipment recommendations and why I recommend them. So these are the presentations that are coming up. So if you missed the last one, it is on my YouTube channel. It's the video before this one. But today, April 3rd, we're talking about equipment recommendations, and then I have 3 more presentations coming every Monday. So stay tuned for which ones you want to hear. I assume next week's will be very popular. That's a common question I get. So just the outline for this presentation, we're going to go over pre-surgery and why you need equipment after you have your surgery. And then we'll talk about the first 2 to 4 weeks after surgery. We'll talk about pain, and then I'll recommend the equipment at the end of the presentation. For those of you who don't know me, my name is Dr. Samantha Smith. I am the creator of SucceedCourses.com and the instructor of our courses. If you haven't visited the website, there are 4 courses available on the website. So we have the prehab course. This is for somebody who has not had their surgery and is looking to improve their strength and mobility and kind of work on the range of motion of your knee, which is very important prior to surgery. The pre-surgery course kind of goes over what the surgery entails, what to expect, and it also includes all the prehab exercises. The post-surgery course is obviously for somebody post-surgery. There's exercises, stretching ideas, symptoms, how to handle stiffness and swelling. Everything is in this course. And then the bundled course has all 3 of these in one course, and you get kind of a better bang for your buck if you get the bundled course. So why do we need equipment after surgery? So I look at a couple factors when recommending equipment for my patients prior to surgery. So these are some of the factors I take into account if I'm recommending equipment. So the older you are, unfortunately, the more issues you might have. Of course, this is not everyone, but generally the consensus is the older you are, you're going to need a little bit more help. Poor balance prior to surgery is a big indicator of needing a walker for a longer period of time, needing help more often during the first couple weeks after surgery. If you've been using a walker prior to surgery, the likelihood of you needing it for a longer period of time after surgery is higher. If you're sedentary, this gives me a clue that you probably will need more help after surgery. And of course, this is if you're sedentary prior to surgery. And this could be because, your knee hurts and you can't get around. So, a lot of people are sedentary before a knee replacement. And then having a lot of comorbidities, being diabetic, obesity, hypertension, all of those do kind of correlate with what you need after surgery and just the help that you're going to need after surgery. So the first 2 to 4 weeks, generally people need some sort of help. You're very sore. You're on a lot of new medications. You're on your pain medications. You're on nerve pain medication. You're on blood thinners, maybe muscle relaxers. So all those new medications are going to be hard for you to acclimate to if you're not used to them. You're going to have the incision pain, which we'll talk about here in a second. And then also you're going to be tired from the surgery. Pain really takes a lot out of you, and research shows that pain activates a lot of the brain, and that causes you to become really, really tired quickly. So the first 2 to 4 weeks, depending on your mobility, prior to surgery, you will most likely need help for the first 2 to 4 weeks. So the incision is the first, pain that we think of when we think of a knee replacement, this incision right down the front of the knee. So this is going to cause a lot of pain. It's going to cause you to not want to walk very far. It's going to cause you not to be able to lift your leg in and out of bed. It's going to, you're going to need help because this is going to be painful. So it's, the first 2 weeks, this is painful, but it's usually not the most painful part of surgery. The most painful part of the surgery is the internal incision. So you have the incision on the front of the knee, which was the previous picture, and then they have an incision underneath the skin. There's a second incision that goes around the kneecap. and up into the quadricep muscle a little bit. So we don't detach the quadricep muscle. You know, maybe 1% of the time they detach the quadricep muscle for a very unique reason, but 90% of the time you're getting an incision that looks like this. This is very painful. This causes a lot of muscle pain and weakness, and a lot of nerve fibers are exposed because of, you know, this incision right here. This is going to cause you not to be able to get in and out of bed. It's going to be painful to lift your leg. It's going to be painful to stand on your leg. So you're going to need a lot of help because of this incision right here. And then also you're going to have internal stitches on the inside that you might be able to feel as you do your exercises. Another thing that causes pain in the first, 2 to 4 weeks is the tourniquet that they use at the top of the thigh. This is to control bleeding during the surgery. So, some surgeons don't use a tourniquet. It depends on the person. It depends on the surgeon. But I would say 90% of surgeons are using a tourniquet. And this is going to be so tight on your leg to control the bleeding. That's very necessary during surgery. But it's going to cause quad weakness, pain, and swelling. So the quad is this muscle right here, this in the front of the thigh. It's going to be so tight on your thigh for, up to 20 minutes during the surgery that it's going to cause damage to the quad muscle. And so this is going to be another reason why you need help in the first 2 to 4 weeks after surgery. This quad muscle right here is going to be very sore after the surgery. So another, kind of obvious one is they remove your bone. So this causes a lot of pain after the surgery. This is the biggest trauma to the knee. They remove the bone, they remove ligaments and bone spurs. If you have any, you're going to have bone pain. And then on top of that, you have a new foreign object recommendations for everybody. So you are going to need an ice pack of some sort. You're going to need this ice pack for a long period of time after your recovery, 3 to 6 months, sometimes even a little bit longer. This ice pack is going to be your friend. And also you're going to need a shower chair of some sort. It's going to be difficult to stand in the shower for long periods of time during the first 2 to 4 weeks, and it's just not safe to stand in the shower without some sort of option to sit down. If you have a bench in the shower, of course that works. And then you're going to need a walker or crutches. Every once in a while I have somebody that uses crutches, but that's usually for somebody who has a little bit younger and has good balance. They may be using crutches, but you're going to want the walker with the 2 wheels in the front, and you can put the tennis balls in the back. But this walker is necessary because it is more stable than the ones with the 4 wheels. So if you've seen the ones with the 4 wheels, don't get that one after surgery. You want this one. It's more stable because you're going to need to lean into the walker to offload some pressure off of your knee. So this is more stable and just more sturdy to do that. And then of course, you're gonna need some sort of some pillows. This is, everybody has at least 3 pillows in their house, and you're gonna need to elevate your legs. So pillows are very necessary. For somebody who is a little bit less active, this may be somebody who's a little bit older, doesn't have really good balance, a bedside commode would be really helpful. This is, something you can put right at your bedside, and you can just go to the bathroom in the middle of the night, and you don't have to get up and walk to the toilet, especially if your bathroom is far away. Most falls happen at night in the bathroom because it's dark, your balance is off, you're half asleep. There's a lot of factors that go into why so many falls happen in the bathroom at nighttime. So that on top of you're taking pain medication, you may be, getting off the anesthesia. If you are concerned about your balance, definitely just get one of these to make your life a little bit easier and safer. And then having a toilet riser is really useful, especially the ones with the handles. I would recommend. It's going to be challenging to get off on and off of low surfaces. If you have a lower toilet, most of the older homes, especially in my area, I'm in the Texas area, most of the older toilets are a little bit lower, but the newer toilets are higher. So you might be okay if you have a newer toilet. A bed rail is really helpful for somebody who does have weakness, especially in their core and their arms. This is really helpful. And then this leg lifter is really useful as well, just because, you know, that quad pain is, you know, really painful. You have that internal incision. You're going to have a lot of difficulty getting your leg in and out of bed for the first 2 to 4 weeks. So, you know, even somebody who's highly active prior to surgery can, you know, use a leg lifter, and it can be really, really helpful. So all of these items I'm going to list below this video, but they all are available on Amazon. But Amazon is the cheapest place to get all of these items, of course, but I'll list them all below this video so you can have links to everything. And then these are things that I highly recommend, but they're not absolutely necessary. I love to have my patients get bikes, just like the little bike that goes on the floor and you sit on a chair and put it right in front of you. This is my favorite one. Again, it's on Amazon. It's really sturdy. It's quiet. You can add resistance with this little knob right here. You can put it anywhere and it doesn't move. This is a little pricier than some of the other bikes on Amazon, but I'll list this one below, and I'll list a couple other cheaper ones if you want to look into other options. And then this is really important, I think, to get if you have the opportunity. This is an ice machine. So the ice goes in here, it filters through the tube and goes into this little pad, which wraps around your knee, and it gets really, really cold. Most people swear by these things. They say it's like what got them through the first 2 to 4 weeks. So if you have the opportunity to get this, I would recommend it. You're going to want to go to the actual website and use this code Dr. Sam 10. This will get you 10% off of your order, and it's actually the cheapest way to get this item compared to Amazon. Amazon, they do have the same prices on Amazon and on this actual website. So, you know, just go to their website. They have free shipping. It's cheaper, and they have really great customer service if you do have any issues. So check it out. And then please check out my courses if you have any other questions about your knee replacement, or if you're looking into a knee replacement. There is everything you need to know are in my courses. I literally go over everything in my courses, so I don't think I miss one thing. I hope not, at least. So yeah, you'll just go to succeedcourses.com, and I also have a lot of blog posts on there that I've written, just like articles of really common questions that I've just experienced throughout my practice, and also in my Facebook group as well. So thank you guys for listening to this presentation, and I'll see you again next week.